On 1st May, that's tomorrow, the fourth phase of India's vaccination drive begins. Everyone above 18 can get a COVID-19 vaccine, in theory. What's really happening is chaos. Registrations on CoWIN and Arogya Setu began on April 28th. The boast from the government was that over 1.2 crore people registered just that day. Many could not as OTPs failed. But most of those who registered didn't get slots. Expanding a vaccine program also requires expanding vaccine stocks. Let's go state by state and do an overview of the situation. Maharashtra says it may receive its order of covishield vaccine only after May 20th. It will receive 5 lakh doses of covaxin in May sometime. Maharashtra estimates it may take a month before they can start vaccinating people above 18. Tamil Nadu, it is waiting for a yes from manufacturers. Gujarat, it's hoping to get some part of its 2.5 crore vaccine order by May 15th. Chhattisgarh will get 25 lakh doses of covaxin only by July end. Punjab asked for 30 lakh doses of Covishield but was told the company will revert back when it's in a position to fulfill the order. Delhi asked for 67 lakh doses of Covishield but will get only 3 lakh doses by 3rd May. Bihar has clearly said phase 4 will not begin tomorrow because they don't have any privately sourced vaccines. Telangana is in search for vaccines. Andhra Pradesh is waiting for a confirmation. Madhya Pradesh was told by both the Serum Institute and Bharat Biotech that they can't supply vaccines just yet. Goa can't get 5 lakh doses because of the Serum Institute's prior commitments to the center. For the same reason, Rajasthan has to wait for Covishield until 15th May. So net, in most places, vaccinations for 18 plus are not likely to take place in good effective numbers tomorrow or even perhaps until mid-May. Why? Why is there a shortage? Starting May 1st, India's total vaccine stock gets split into half. 50% goes to the center, which gives it to the states, but these can only be used to vaccinate those above 45 for free only at government hospitals. The other half is in the open market. States and private hospitals can buy on their own. Private hospitals that were till now vaccinating those above 45 at the subsidized cost of $250 have to return all their vaccines before 1st May. Yes, take a moment to digest that. If they want to vaccinate, they now have to procure directly from vaccine manufacturers or ask state governments to buy on their behalf and pass it on. Only the 50% that states and private hospitals buy on their own can be used to vaccinate those between 18 to 45. The bottom line is that the center is not procuring or paying for this group, which is nearly 60 crore people. Either the states lift that burden or it gets passed on to people who choose to get vaccinated at private hospitals. Now, whether people who can afford to pay should or should not is not the debate of this video or the focus of this video. All experts outside the government are saying this is an unnecessarily complex and decentralized model for immunizing a billion-strong country which needs vaccines as soon as possible. And everything except registration is now the state's responsibility.
Now let's talk about supply. India has 2 COVID-19 vaccines for the foreseeable future. Serum Institute currently has a production capacity of 70 to 100 million doses of Covishield per month. Bharat Biotech can make about 12.5 million doses of covaxin per month. Both these companies plan to increase capacity, but only by July. Their current combined capacity is not fast or vast enough to vaccinate even the vulnerable groups. India will start receiving Russia's Sputnik 5 by May end, but not in any significant quantity. And Johnson & Johnson's vaccine will augment supply much after July. And yet, vaccination has been opened for all from May 1, apparently. 50% of this already low supply goes to the center, the rest goes to the states. The subtext is that this 50% takes priority over the state's 50%. The center has placed orders with SII and Bharat Biotech for doses until July. It's safe to say that most of the vaccines that will be produced in May and perhaps even after will go towards fulfilling the center's quota first. This leaves states and private hospitals scrambling to get the remaining vaccines at prices much higher than what the center has been paying per dose. There are no clear guidelines on how the manufacturers will prioritize between states and private hospitals, which explains why most states that placed orders to begin their 18+ vaccination drive from tomorrow have come back empty-handed. Private hospitals have to return what doses they received in phase 1 to 3, so it will be weeks till they can vaccinate anyone at all. Because as I said, the center's orders to vaccinate 45+ are getting priority. But that does not mean vaccination for them is going smoothly. Ground reports from Kolkata to Trivandrum to Manipur and Delhi are dismal. Reports of people being sent back, scheduled appointments being indefinitely postponed. Because, number one, vaccines are over. Mumbai has suspended vaccination entirely till May 2 because vaccines have finished. Or number two, they don't have the right vaccine. Let me explain. Assam in mid-April received a large batch of covishield. But when these people who got covishield came back for their second dose, the state had covaxin, so these people had to be turned back. Telangana, with a capacity to vaccinate 10 lakh people a day, has been vaccinating 2 lakh a day because they don't receive enough vaccines from the center in one go. Odisha has suspended vaccination for people above 45 in 5 districts. And a senior official in Jharkhand told Indian Express that the state has written to the center for 50 lakh vaccine doses, but radio silence. Yesterday, the Union Health Minister said that states have 1 crore doses with them and that there is no shortage of vaccines for the 45+ age group. Then again, that's also what we have heard about no shortage of oxygen. In contrast, an ISP study presented before the Niti Aayog estimated that India is looking at acute vaccine shortages till July. I'll stop here for today. This chaos has been predicted. In an ideal world, getting a vaccine should be much easier for everybody, but it isn't. And the best you can do is engage in COVID-appropriate behavior and keep checking the COVID website for vaccine slots regularly and getting vaccinated as soon as possible. A reminder, walk-in registrations are not allowed for the 18 to 45 group. If you found value, clarity, and some relief from the noise out there, please share this with your friends, your family, on your feeds. And if you have the bandwidth or the resources, you can also support us in doing more independent, empathetic journalism worthy of your time. The link to donate is in our bio. For those of you who have been listening, thank you so much for your time.